Good day, everyone. This is column 4, and we are going to discuss chapter 14, Feminist Therapy. So, according to Blanchfield, a feminist therapy is a type of counseling that focuses on how gender affects a person's life and mental health. So, it looks at the problems women may face because of unfair treatment, such as bias, discrimination, stereotypes, or unequal opportunities. So, in here, ang counselor or ang therapist helps the client understand how society and gender expectations affect their feelings and experiences, and also to recognize unfair treatment or pressure they may have faced, and also to build confidence, empowerment, and healthier ways to cope. So in short, ang feminist therapy helps people, especially women, understand how gender-related unfairness and social pressures can affect their mental health, and also to support them in feeling stronger and more empowered. So, three main interests of feminist therapy. First is to develop or to create a feminist way of doing counseling. So, kani mo develop sila og mga approaches or methods that understands women experiences. Next is looking at whether the counselor and client are the same gender or different. Because, for example, no, kay nay ubang mga baye or there are other women who feels more confident or who feels more comfortable talking to a female therapist. Well, for some others, they don't mind. And next is making counseling approaches for women's specific experiences. So this means creating therapy methods that helps with issues women face, and such as gender discrimination, family expectations, and etc. So in short, ang feminist therapy studies how to make counseling fair and helpful for women, and how therapists gender can affect therapy, and how to create counseling methods that addresses women's real life experiences. So there are types of feminist therapy. Kini siya kay traditional ni siyang types of feminist therapy na liberal feminism. Example ani is a therapist helps a woman build confidence to ask for equal pay. And the next is cultural feminism. Example ani is a therapist encourages a woman to value her caring and emotional strength. Next is radical feminism. A therapist helps a woman understand that sexual harassment or unfair treatment is caused by unequal power in society. And lastly, the socialist feminism. Example ani kay a therapist helps a woman see how low pay, gender discrimination, and together affect her stress and life opportunities. So a feminist approach should include an equal relationship between therapist and client. Next is using a consciousness raising approach. So ani helps the therapist helps women understand how personal problem can be connected to social issues, and also to encourage women to discover their strength and personal power, and to also encourage and recognize, challenge gender stereotypes, and also to help women learn that their experiences are often shared by other women. And then also to therapy helps women express feelings like anger in a healthy way. And also it helps women see themselves as individuals and not only through roles like wife or mother. And natay model aning under sa feminist therapy, which is the stone center model, which emphasizes empathy, mutuality, dependency, and caring. For empathy, this is a central element of the stone center approach. So ani lang jud siya kay empathy means understanding and feeling what another person is going through. Next is mutuality. Mutuality means both the therapist and the client learn from each other. Next is dependency na ay gi-emphasize diri nga healthy dependency can be regarded as providing opportunities for growth and development. So in here, that it states that depending on others is normal and healthy, and asking for help and support from others can help a person grow. Next is caring. Therapists should show genuine care and concern for their clients, and that is That's it for the stone center model. Next is the radical feminist therapy. Thank you.
Good day, everyone. I will be talking about the radical feminist therapy. What is radical feminist therapy? Radical feminist therapy examines the effects of social structures in the lives of women. This therapy focuses on the social and material conditions in which women live. Dili ni para sa ubang approaches nga magsugod sa personal relationships. Instead, the therapy starts with society. Radical feminist therapy is based on four several assumptions. First, women are often reduced to bodies that exist for men, and these bodies can be violated. Pasabot, sa society, instead nga irespeto ang mga bae as whole individuals, they are treated as objects meant to satisfy men. Tungod ani, women may experience different forms of abuse or violence. Second, violence is considered an integral part of women's experiences, meaning violence is a common reality daw nga matubang sa mga bae in their lives whether directly or indirectly. And third, extreme forms of violence such as rape, sexual abuse, and physical abuse create the context where other forms of violence occur. So, sa nahinganlan katong mga serious forms of violence, ma-create sila environment where other smaller or less obvious nga violence such as katong mga harassment or control may also happen. So basically, mapa-extreme man or dili ang violence, they are all connected. One makes the other more likely or gives it meaning. And lastly, many women either experience extreme violence or live with a constant threat of it. Bisan pag wala naka-experience of extreme violence, many women live with a fear or possibility nga it could happen to them, which is makaapekto sa ilang behavior sa society. Next, socialization of women. Radical feminist therapy says that the way giun sa pag-treat ang mga bae sa society kay influenced by male dominance or power over women. So tungod ani, i-expect sa society nga mo follow ang mga women sa certain gender roles such as being passive, attractive, or dependent on men. And then, kini nga mga expectations sa society makaapekto on how women see themselves and may also contribute to stress, low self-esteem, or other psychological problems. And the main goal of radical feminist therapy is empowerment, which means helping women feel stronger and more in control of their lives. But in what way? Sa radical feminist therapy, ang therapist motabang sa client para makarecognize ang client kung naka-experience ba siya oppression or unfair treatment sa society. After nga makarecognize or makasabot na ang client, mo-support na po si therapist in creating positive changes. This may include gaining confidence, building support with other women, or joining community efforts that promote equality. Another important concept in radical feminist therapy is mystification. Mystification is when ang mga powerful nga people mo create silang ideas or beliefs nga himuong normal or acceptable ang unfair nga treatment. Tungod aning mystification, naay possibility nga i-blame sa mga bae ilahang kaugalingon nga maoy nakaingon ana nga problem instead of seeing naa di ay social inequality nga nahitabo. Now, let's talk about the languages in feminist therapy. First is egalitarian language. Ang therapist makistorya sa client as equal, dili as someone nga mas labaw sa client. Also, the therapist believes nga ang client mao'y expert sa iyang own life. Example, instead of telling the client what to do, moingon ang therapist nga unsa may tan-aw nimo nga mas maayong buhaton ani nga situation. Second is empowering language. Dire mogamit ang therapist og mga words nga maka-encourage or makatabang para mas ma-recognize sa client iyang strengths and abilities. Example, ingnon ni therapist si client nga, you showed a lot of strength by speaking up about what you experience. Third, non-pathologizing language. Ani, likayan sa therapist nga, labelan si client as sick or disordered. Instead, ilang hunahunaon nga, ang gipakita nga feelings or reactions sa client kay normal nga responses sa ilang mga naagian nga situations nga lisod. Example, instead nga ingnog naa kay disorder, mingon ang therapist nga normal ra imuhang reaction tungod sa imuhang mga naagian. Fourth is context-aware language or personal political. Pasabot ani, Tanawon sad sa therapist ang mga social factors nga makaapekto sa client like discrimination, power imbalance, and others. For example, mga tana si therapist nga sa imong trabaho naka-feel baka nga lahi ang treatment sa mga bae ug laki. And lastly, direct and transparent language. Ani, mo communicate si therapist openly and honestly. Mga tana siya mga clear and open-ended questions para masabtan ang feelings and experiences ni client. So, overall, feminist therapy uses language that empowers the client, treats them as an equal, and understands their experiences without labeling them as sick or disordered. That would be all for my part. Thank you.
So good day everyone, I am RJ Elaine Deslos and I'll be walking you through the heart of feminist therapy, which is the therapeutic procedures, the interventions, as well as the methodology. So before we take a look at the specific techniques, we have to understand that the golden rule of this approach is unlike the traditional therapy, which can sometimes feel like the therapist is the expert talking down to a patient. So the core tenet of this therapy is the egalitarian relationship, which means that the therapist and the client has equal power, no, or are equals. It's a partnership that is built on the shared power, which sets the stage of everything that I'm about to discuss. So let's dive on the first few techniques. Now, first is the bibliotherapy. So think of this as a homework for the soul. The therapist suggests readings of books or articles, and that helps the clients know and understand the gender inequality and the power differentials. So this helps the client to realize that their struggles aren't just in their head, but often a part of a larger social structure. So second is we have a viewing symptoms as communications. And in feminist therapy, we are non-pathologizing. This means we aren't just looking for a diagnosis or a disorder. Instead, no, we see symptoms as a reaction to the environment. For example, if a client has the anxiety about their job performance, so we just don't call it as a disorder, but rather we deconstruct it. So we look at how the patriarchal norms or the workplace inequalities affects or causes distress. And third is the power analysis. So this is where the client and the therapist examine exactly how or where the power sits in the society. So we look at how the lack of power in non-male gender impacts the person's ability to grow. So it's not about blaming society for every single problem, but about recognizing the real unequal power dynamics that affects a person's success and the mental health. And so moving to our next set of tools, we have reframing as well. Now this isn't just looking on the bright side. It's a community psychology approach. We shift the perspective gikan sa personal failure to social factors. So we take mental health issues and reframe them in a strength-based way, looking at how the client has survived despite their environment. Mo na ang katong reframing. Next is self-disclosure. To keep the egalitarian balance I mentioned earlier, no, therapists must share their own life experiences para sad nga naay para gyud nga naay kanang shared nga kanang para ma-feel ni client nga na sila equal sila ni therapist. So this helps normalize the client's feelings and equalizes the relationship, so making the therapy a shared human experience rather than a clinical one. And so we also use the gender role analysis. Now this is the gender role analysis and intervention. This is a deep dive into how gender roles specifically impact the client's mental health. So by exploring these roles, the client gains insight into why they feel pressure to act or feel a certain way. So finally, we have social action. So this is a unique form of technique, no, sa feminist theory. So therapists may actually encourage clients to engage in social activism. So nga naman, because taking action to change the world is one of the most important things or empowering things a person can do for their own mental health. So in summary, the methodology of feminist therapy isn't just about fixing a person. So it's about understanding the person within the context of their own world. So from bibliotherapy to social action, so these techniques are designed to empower individual by addressing the power imbalance in the society. So thank you so much for your time. I hope nga nakasabot this as well. Basically, si feminist therapist no, mo na siya ang gi-describe as an integrative or all-purpose nga practitioner who acts as an egalitarian nga collaborator and social activist. So, the feminist therapist is integrative, meaning to say they combine different roles depending on the client's needs, no. They also balance, they support, they educate and empower and collaborate, no. So dili sila pare sa traditional nga murag expert tan-awon si kanang si counselor or si therapist mas expert siya sa client. So nas like equal power. And the feminist therapist as well, this kind of therapy does not act as the expert above. Like I've said before, dili siya mo act as expert above the client, but as a partner in the process. So that is feminist therapy.
Nika is a 24-year-old marketing assistant who recently started working at a large corporate company. She is passionate, creative, and full of ideas. But over the past few months, she has begun to feel invisible in her workplace. During meetings, Nika shares her thoughts, yet they are often overlooked or dismissed. However, when her male colleagues present similar ideas, they receive recognition and praise. Because of these repeated experiences, Nika has started to question her own abilities and self-worth. She feels discouraged, anxious, and hesitant to speak up. Today, Nika meets with her therapist to talk about what she has been going through, hoping to better understand her feelings and regain her confidence.
Oh, hi Nika, it's good to see you again. Before we begin, I just want to say that this space is collaborative. Your thoughts and experience are valued here.
The therapist sets a supportive and equal environment, emphasizing collaboration, an important principle in feminist therapy.
Hello ma'am, maybe nag-start dito sa akong work. Noon sa day, what's been happening? During sa akong meeting nag-share ko ideas. But ako nga kaulong is giving away na work because I respond. Then later, one of my male co-workers say something similar. And then everyone praises her. Unfair kayo mo, no? Feeling na ako, murag hindi importante ang ideas para nila.
Nika begins to describe a pattern that has been affecting her confidence and sense of value in the workplace.
That sounds really frustrating, dude. Anyone in your situation feels discouraged.
The therapist validates Nika's feelings instead of dismissing them, helping her feel heard and understood.
Project ko na kumawala at I always assume na what's my goal? Rebecca, your action is understandable, but your ideas and your voice are important too. The fact that you keep speaking up shows strength.
The therapist reframes Nika's experience, helping her recognize her resilience instead of focusing on self-doubt.
I guess wala ko na straight before. Wala. Siguro maybe we can work together on ways to feel you more confident, share your ideas, and also recognize that some of these challenges comes from a larger social patterns, not just you.
The therapist empowers Nika by focusing on both personal growth and awareness of systemic issues.
I like that. I want to work with the next. That sounds like a great goal, and we'll work on it together.
Through this conversation, Nika begins to understand that her experiences may be influenced by workplace gender dynamics rather than personal failure. The therapist validates her emotions, highlights her strengths, and encourages her to see yourself within a broader social context. Feminist therapy focuses on empowerment, equality, and recognizing how societal structures impact individual experiences. By the end of the session, Nika feels more hopeful, supported, and ready to rebuild her confidence and voice.
For a better understanding of feminist therapy, here is a brief 4-minute clip discussing the concept.
Feminist therapy is an approach that recognizes and addresses the effects of power, oppression, and privilege in the therapeutic relationship. It acknowledges the impacts of social structures such as gender, race, class, and sexuality on our experiences and encourages individuals to examine how these factors influence their mental health. This therapy approach seeks to empower individuals and create a safe space to express their thoughts, emotions, and experiences without fear of judgment or discrimination. Feminist therapy is a type of psychotherapy that focuses on how social and cultural factors impact a person's mental health. This approach aims to empower individuals by recognizing and addressing how systemic oppression and discrimination contribute to their struggles. It emphasizes the therapeutic relationship as a partnership between the therapist and the client, emphasizing mutual trust, respect, and collaboration. The origins of feminist therapy can be traced back to the feminist movement of the 1960s and 1970s, which called for recognition of women's experiences and the need for social change. This movement led to the development of a new approach to therapy that challenged traditional views of mental health. Feminist therapy techniques aim to create a collaborative, non-judgmental therapeutic relationship between the therapist and client through techniques such as consciousness raising, reframing, and externalizing. Individuals can gain a deeper understanding of their experiences and develop new ways of thinking and coping. Feminist therapy techniques can be helpful in the following situation. Gender-based trauma, where feminist therapy techniques can be helpful for individuals who have experienced trauma related to gender discrimination or gender-based violence. Relationship issues, where these techniques can be used to help individuals navigate relationship issues, particularly in situations where traditional gender roles or power dynamics may be contributing to conflict or inequality. Body image and eating disorders, where therapy techniques can help address body image concerns and eating disorders, particularly those influenced by societal pressures and norms surrounding beauty and thinness. Identity development, where techniques can be helpful for individuals who are struggling with questions of identity related to gender, sexuality, race, ethnicity, or culture. Mental health concerns, where therapy techniques can treat various mental health concerns including depression, anxiety, trauma-related disorders and personality disorders, and social justice advocacy. These techniques can also be used to support individuals who are engaged in social justice advocacy, helping them to address issues related to gender equality, human rights, and social justice. Feminist therapy techniques can help individuals overcome the challenges they face in their daily lives by addressing their individual experiences through a feminist lens. Here are some examples of feminist therapy techniques. Consciousness raising, which encourages clients to explore and understand their personal experiences within a broader societal context. Empowerment, which focuses on helping clients gain confidence, control, and autonomy in their lives. Intersectionality, which recognizes how different social identities intersect and impact experiences of oppression and privilege. Social action, which encourages clients to engage in activism and advocacy to promote social change. Self-disclosure, where the therapist shares personal experiences with the client to help build trust and connection. Reframing, which encourages clients to view problems through a different lens and challenge societal messages. Self-compassion, which encourages clients to practice self-compassion, self-care, and to challenge internalized messages of shame and self-blame. Mindfulness, which encourages clients to practice mindfulness and presence at the moment and to recognize and accept their thoughts and feelings without judgment. Externalization, which helps clients separate their identity from problems or challenges they may be facing. And psychoeducation, which provides clients with information about mental health, societal issues, and strategies for coping and self-care.